Evidence-based practice. Bridging the gap between research and healthcare management. The objectives of this presentation are to discuss the following: the definition of evidence-based practice, also known as EBP, history of EBP, relevance of EBP to nursing, challenges or barriers in the application of EBP, steps in applying evidence-based knowledge in nursing practice, and the role of nurse leaders in promoting evidence-based practice.
The key problem that evidence-based medicine addresses is the issue of trying to sift out the best evidence that's coming out through research and using it to improve our patient care, to change the way that we practice.
The College of Nurses of Ontario defined evidence-based practice as the integration of knowledge of the best available research, client preferences, resources and clinical expertise when making decisions with a client about achieving the best possible health care. To give a little background, the evidence-based movement began with medicine. The term evidence-based medicine was coined at McMaster University's School of Medicine, in Hamilton, Ontario, during the 1980s. It referred to a clinical learning strategy that had been in use at McMaster University since the 1970s. However, healthcare decision-making extends beyond medicine. Before long, the term evidence-based practice was coined. It was considered a more encompassing and neutral term that incorporated evidence-based medicine with evidence-based care, a blend of the beliefs, values and attitudes of clients, families, and practitioners, with the most current knowledge of incidence and prevalence of the healthcare problem at hand and an understanding of the organization and delivery of healthcare. So, how is evidence-based practice relevant to nursing? Until about a decade ago, when a red spot appeared over a bony area on a patient's skin, nurses would rub the area gently to improve circulation. Such treatment seemed to be common sense. But then along came studies that showed exactly the opposite to be true. Rubbing the skin can actually damage the tissue, and nurses stopped the practice. Evidence-based practice enables nurses to provide the highest quality of care in meeting the multifaceted needs of their patients and families. In Ontario, with funding from the Ministry of Health and Long-Term Care, the Registered Nurses Association of Ontario began the Nursing Best Practice Guidelines Project, an initiative to facilitate clinical decisions that were based on the best available evidence. In 2004, Health Canada provided further funding to enable the initiative to distribute its results across Canada, including translation into French. Currently, 30 English guidelines have been prepared, and 12 are available in French. 6 Healthy Work Environments guidelines have recently been developed to enable nursing leaders and their organizations to create positive work environments for nurses. In spite the EBP's importance in nursing, there may be some challenges or barriers in its application in practice. First, is the nurse characteristics. This can include lack of research skills and inability to critically synthesize the literature. Second, is the organizational characteristics, which includes lack of time for nurses and different goals for practice between administrators and staff nurses. The nature of research information can be quite a challenge as well, as research can be seen as too complicated or too scholarly. And lastly, the healthcare environment. Environment that diminishes nurses' independence or authority over their practice, will decrease the integration of evidence-based practice. There are, however, 5 steps in applying evidence-based practice. Step 1. Define the clinical question. Step 2. Search the literature. Step 3. Critically appraise the literature. Step 4. Decide whether and how to use the information. And lastly, Step 5. Evaluate the effects of your decision. The 5 steps are discussed in detail in the bookmark given at the beginning of this presentation.